Welcome, welcome, welcome back to another week of Excuse Me, Doctor. My name is Dr. Melissa Clarke. I am your host, and I am delighted to be here with you this week. We're here each and every week at Excuse Me, Doctor, making sure that you have the information that you need to make the best health decisions for yourself, your family, and your community. And of course, we're right here streaming on Facebook. Please hit that like button if that's where you're joining us. And if you're joining us on YouTube, please make sure you hit that subscribe button. So now we are going to get into creating an amazing week for ourselves with all the wonderful health topics we're going to cover today. I have to bring in my fantastic co-producers, Wayne and Lila. Come on in, bring us the
What up?
word from the streets.
Hey,
Great to see
Dr.
you
Mel.
all.
What's going on with you?
Hi.
Yeah, what's going out there in Cali? How y'all doing?
We're hanging in there. We're hanging in there out here. Yeah, we all right.
You sound like it was a whole thing. Is it a whole
It was.
thing hanging in
It's
there?
been a whole thing. It's been a whole thing all weekend, but here we are.
Here we are. Yes,
Here
yes.
we are.
Here we are. Here we are. Here we are.
And
Great.
we have a
Great
great
to
show
be here.
lined up too.
Oh,
We
excited
do.
today. I'm excited.
What are we
Yeah.
talking about?
We're talking about medical cannabis, how it's taken off. Their claims that it cures everything from COVID to arthritis. So we're going to get down to the
Right.
bottom of all of that. What's the real story? We have a fantastic guest who is an integrative medicine practitioner, and she sits on all kinds of boards having to do with medical cannabis. So she's going to help us break it down. So I hope
Okay.
everybody is ready with their questions.
Mhm.
Awesome.
I'm ready with
Awesome.
my question.
Are you?
Okay.
I am
Just
ready.
one?
I'm locked and
Oh,
loaded.
that's what I was
with
going to say, Dr. Mel. You're with your one question? Okay.
Right. He's been holding on to it all week, I guess.
Just one. I just want to
All
know
right.
one thing. No,
Okay.
I have a few
Okay.
questions. I'm quite sure our audience will. But before then, Dr. Mel, we got to go to the recap, babe.
We sure do. We got a lot to cover.
There we go.
Indeed.
Yep.
Indeed.
So, yeah, let's start off with the numbers because they're going up.
Yeah.
Haven't really talked about, numbers rising significantly, but they are now. We're getting 44,000 new cases added a day. That's up 40% week over week for the last couple of weeks. And we know that that's way underestimated because there's so many people doing home testing. The estimate is that it's 90%. One article I read, 90% underestimates of what what the actual case count is. Yeah. So but the thing is, are these cases going to translate to hospitalizations? And
Right.
so we got to look and see whether the hospitalizations are rising. What do you guys think? You think they're rising?
I don't know.
I think so.
It-
I bet they are.
you think?
If you were putting money on it, you would have made a ton because
Okay.
yes, that's what's
Wow.
happening. They're up 9% since last week. We're not seeing it nationwide yet. There's certain pockets, the Northeast, the Mid-Atlantic, a few places in the Northwest. But we're hoping that it's not going to be like a sharp rise like how we saw with Omicron because the number of people who are vaccinated and the number of people who got Omicron in the last surge. So this is a sort of a takeoff on Omicron. It's a variant of Omicron. So the people who had Omicron are going to have a little bit of protection because of that, as well as the people who are vaccinated.
Okay.
So, yeah, and deaths are still going down, so that's fantastic.
Well, the
But
deaths
of course,
going down
That's awesome.
always help us.
always. But deaths lag behind hospitalizations, which have just started to go up. So we got to just keep our eyes open. And now is not the time to not wear the masks, despite
I
the
mean,
transportation thing.
seem like common sense to me. But
Right.
speaking of masks, though, Dr. Mill, Does one-way masking work? Like if one person has a mask on and other people don't, how effective is that?
Well, that's the question everybody's asking as they're getting on airlines and going through airports and getting on trains, Amtrak, and the subway systems in their city, because all those things, all those places have gone away, done away with the mask mandate. There's no question that two-way masking, when it's done consistently and correctly, is the most powerful way, one of the most powerful ways to cut down the spread of COVID. However,
Mhm, mhm.
you just wearing your mask by yourself does help you much more than if you weren't wearing it at all. But the
Okay.
quality of the mask is the key. And you know what the best masks to wear are, right?
Right. The
Okay,
N95s and the
N95.
KN95s.
Right, exactly. And the 95 actually means that it keeps out 95% of airborne germs. So that's what the 95 means. Now, that's when you actually get it fitted to your face professionally. But if you
Mhm.
don't, it still keeps out 75 to 80% of germs. So that's really good. So here how the numbers sort of stack up. If you were just wearing a surgical mask, which is better than a cloth mask, and you were around an infected person and they weren't wearing a mask and you were about 5 feet away from them for 30 minutes, you would have a 90% chance of being infected with COVID. If you put on an N95, though, in the same scenario, you're 5 feet away from an infected person, your risk drops to only 20% of getting infected, and that's over an entire hour, not just over 30 minutes. So that tells you how much more effective the N95 is.
So from 90% to it drops from 90% to
For a
20%.
half an hour, 20% over an hour. Yep.
Wow.
Yeah.
I'm scared again.
I mean, I've been scared.
So look. So the big dude, because I'm a big dude, so don't nobody come after me. The big dude with the teeny tiny mask that barely fit over his bottom lip and his nose, with the surgical mask that don't fit, that's straining on the string.
On his ears.
We ain't got a shot. He ain't got a shot.
Well, yeah. I mean, if he's going to be around an infected person for 30 minutes, yeah, he has a high chance. Of course, without ventilation and all that. Now, remember,
Mhm.
airplanes have great ventilation, but it's the boarding the plane and getting off the plane once they turn the ventilation system on that's the problem. And of course, subways don't have as great ventilation as airplanes. So these are all things to consider as you're moving around. Get your N95, get vaccinated, get boosted, because that cuts down the risk as well. And try to stay socially distanced when you're in indoor spaces.
All right.
All right.
All
So
right.
this is interesting that this is in the recap this week, but let's get into it. Opioid deaths and Black people. Why did you add this one, Dr. Mel?
Because we have some not so great news. So, we heard about 10 years ago that white people had really high opioid death rates, and that was terrible because
Mhm.
we heard that it was so bad that the life expectancy for our white brothers and sisters had actually gone down by 1 to 3 years as a result of the deaths that were happening around opioids. Um, Now, though, the dynamic has shifted. Actually, American Indians and Alaskan Natives have the highest mortality from drug overdoses, and this is
Wow.
2020 data because we don't, the overdose death from opioids, that data lags by about a year and a half. So this is
Mm.
2020 data. But the largest surge in deaths from opioids occurred among Black people. The jump was almost a 50% jump. And
Wow.
that's the first time since 1999 that the rate of drug deaths among Black people in the United States surpassed that of whites. And the demographic over 55 that had the highest opioid death rates were Black men. They actually drove the huge spike in death rates of people over 55. It was mainly Black men. Their rate quadrupled. And the crazy thing is that even though Black people and white people use drugs at similar rates, the inequalities in drug-related arrests and incarcerations among Black people, as well as access to addiction treatment and medication like buprenorphine that you can just get at a doctor's office, the lack of access to that, all those things are contributing to the disparity in overdose deaths.
Wow.
So,
Wow.
it's something that affects us all. And I think that's one thing that we should all remember.
Wow.
Indeed.
Terrible. That's
Yeah.
terrible. So, Dr. Mel, I had a question that came from a couple of my friends who are getting older, and they want to know, they're having problems with their memory. They're always questioning, is it Alzheimer's or is it just old age? So,
That's an excellent question, because I know we've heard everybody say, "Oh, I'm having a senior moment," and when they're having those senior moments, they're also probably asking themselves, "Is this early dementia, or am I
Right.
just getting a little forgetful?" Right?
mhm,
So the thing is that our brain is growing and developing up until about age 30. After that, it goes into aging mode. So memory lapses can happen to anybody as they age. So, for example, a 20-year-old will probably remember a 10-item grocery list, but a 60-year-old will probably need to write that list down. That's normal, right? But
mhm,
what distinguishes simple senior moments from actual dementia is really a combination of, it's not just memory, it's a combination of memory, problem solving, reasoning, word finding, and carrying out multiple step tasks like cooking, right?
mhm,
That have a sequence that you have to follow the sequence. So people with dementia have problems with all those things. So a lot of people don't know, when you if you have a real question about that, you go to a neurologist, and the neurologist takes you through a battery of tests. It lasts about 4 hours, and will help to evaluate each of those areas to see how you're doing. The bottom line is, if memory problems are really affecting your everyday life and getting worse, like missing appointments, having trouble using a cell phone, getting into a lot of fender benders, making errors in check writing, that's definitely the time to seek medical attention.
Okay.
and
Yeah.
there we
All
have
right.
it.
Good to know.
Yep.
So, you know, I'm on this weight loss journey now, trying different programs, Mediterranean, South Beachy, and now my friends are trying to even get me to eat vegan or plant
All right.
based.
Okay.
So I see you have it up in the recap. Let's talk about it.
Well, we had a whole show on
Right.
It's All About That Plant-Based Life, right?
Right.
And so this is something that I came across after we did the show, that I think it's important to add. This new study came out
Mm-hmm.
that shows that a vegan diet for people with rheumatoid arthritis actually improved joint pain, joint swelling, and inflammation. And rheumatoid arthritis, for those people who don't know, it's a common autoimmune disease where your antibodies start to attack your joints, causes swelling, pain, and actually can cause permanent joint damage. It's actually more common in Black people at younger ages, right?
Mm-hmm.
And meaning Black people get it at younger ages than whites do. And um, the vegan eating, though, in addition to reducing the pain and swelling, also for the intervention group, resulted in like a 14-pound weight loss, plus their cholesterol went down, versus the comparison group, the placebo group, their weight actually went up 2 pounds.
Okay.
So it had multiple benefits. And so just wanted to put in a little plug for those vegans out there, those people thinking about going vegan, especially if you have rheumatoid arthritis. You might want to talk with your doctor about it to see, can this be added into your treatments?
Wow,
Cool
that's
beans.
good to know. Shout
Yep.
out to Dwayne Perry, who said, Dwayne Perry says, absolutely not vegan.
It's not for everybody, right?
Sounds
And
like
one of the
Dwayne is
things
going to be on the grill this year.
well, one of the things we heard about, It's All About That Plant-Based Life, is it didn't have to be exclusively plant-based. It just meant eat the preponderance of your diet being
Okay.
plants. You can
Right.
still slip some meat in there, you
Right.
know, here and there. Yeah.
Just
So
no hot Cheetos.
right, just no hot Cheetos. Yeah. Stay away from the processed foods that have colors that are not natural for food.
Right. Okay. So look, you do know what time it is.
What time is it?
The weekly debunk. Stopping misinformation in its tracks.
This comes from our good family friends, the Twitter finger family friends. This is cousin Timothy. Timothy texted me and said, I heard that the vaccine is really like AIDS. My friend was on an international Zoom call with pathologists and doctors who said our immune system is being wiped out.
I don't know about that one, Timothy. Excuse me, Dr. Mill, is that true?
No, it's not true. And the construct of this particular piece of misinformation is typical of misinformation, where it tries to throw in something that makes it sound legit. Like I was on a phone call with pathologists and doctors and all that. Let's level set. COVID-19 vaccines do not contain, nor do they cause HIV or AIDS. We remember AIDS, it's a chronic condition that interferes with the body's ability to fight infection and disease. It's caused by the human immunodeficiency virus, HIV, unrelated to COVID-19, unrelated to COVID-19 vaccines. There's been no evidence in the past, year plus, year and a half, that we've been getting COVID vaccines, that they weaken the immune system in any way. And it's actually almost 2 years, if you really count, since the beginning of the clinical trials. The numbers show that administering the COVID-19 vaccines overwhelmingly keep people out of the hospital and alive. That's because instead of weakening immune cells, they actually stimulate your body's immune cells to produce antibodies. And we all remember what antibodies are. Those are those proteins that your body makes that act like customized hitmen against the COVID virus. So they stimulate your body to produce antibodies. And they also stimulate your immune cells to divide and create more immune cells, so that when the antibodies finally, that first wave of antibodies that get produced when you're exposed to the COVID virus, when those go away, your body still has the cells that remember how to make those specific antibodies. It's a beautiful thing. And that lasts for a much, much longer time. So there's been no evidence that the Pfizer, Moderna, Johnson & Johnson vaccines cause that. They contain only a small portion of virus genetic material, and then the fat, sugar, and salt, which protect the virus. Which protect the genetic material as it enters the body, and then shortly after entering the cells, it gets destroyed, kind of like a Snapchat. Once the message is delivered, the messenger gets destroyed. So, bottom line, no, this is not true.
And there
All right.
you have it. Once again,
Timothy.
the Twitter finger family foiled.
Well, thank you all. Thank you all for Lila and Wade for walking us through the recap and the debunk. We're going to see you back in a little bit. I want to remind everybody, please go ahead and start putting your questions in the chat, because you know it's going to be first come, first serve, because we have this wonderful guest who is going to talk with us about medical cannabis, which is currently legal in 37 states. And with 94% of Americans in favor of legal access to medical cannabis, it seems as if this treatment option is here to stay. Many people are aware of recreational marijuana, but with dispensaries popping up in many cities and related products in pharmacies and health food stores alike, I'm sure a lot of people have questions. So that's what we do here at Excuse Me Doctor. We help you get your questions answered. So without further ado, I really want to introduce our wonderful guest, Dr. Patricia Frye. She's an integrative medicine doctor experienced in using cannabis in the medical management of multiple conditions in all age groups. She serves on the Maryland Medical Society's Task Force on Medical Cannabis and the board of the Society of Cannabis Clinicians. In addition, she wrote the Medical Marijuana Guide, Cannabis and Your Health. Welcome, Dr. Frye.
Hello, thank you for inviting me.
I think we have a freeze, Dr. Frye.
Technical issues with Dr. Frye. There we go. Okay. Can you hear me okay now, Dr. Frye?
I can hear you. Can you hear me?
Yes, I can, and we are delighted to have you. I just finished introducing you, and I don't know if you heard that, but I'm so happy that you're
did.
glad. Wonderful. I'm so happy you're here. So, I want to, before we even get into it, you're an integrative medicine physician. Can you tell people what that is, please?
Well, I use lifestyle changes like nutrition, a little discussion on plant-based diet, exercise, mind-body techniques to help the body to heal itself as opposed to relying only on pharmaceuticals to treat symptoms. So oftentimes we say in medicine that it's the surgeons that actually cure things because when they can cut something out or reconnect something, it takes care of the problem. Often in medicine, we are alleviating symptoms and we may be helping to keep things from getting worse, but we oftentimes aren't really making any big changes to take care of the problem. With an integrative practice, there's a lot of emphasis on things like nutrition, avoiding additives and emulsifiers, all of the things that upset the microbiome that negatively impact metabolism, insulin sensitivity, inflammation is a big thing. So it is taking some evidence-based complementary medicine with traditional evidence-based medicine and kind of bringing the two together. So that's what integrative medicine is.
Thanks. I wanted everybody just to hear that so that they know who you are and what your philosophy of health and healthcare is. And so with that level set, I'd love to know, how did you first start to integrate medical cannabis into your practice?
Well, interestingly, I was somewhat retired and had left California, still had my California license, and came back to the East Coast. And after some time of retirement, decided that I really wanted to do some medicine and looked for a telemedicine job. And I was called about a job out of San Francisco where I could work from home here on the East Coast, and it was doing medical marijuana evaluations. Well, my response was, I don't know anything about marijuana. And but I decided to take the job, and initially I was denying people because I was going by the Board of Medicine's recommendations for certification, and so I almost got fired. And I actually spoke with my ex-husband, who's still in California, and he's an ID doc, so he has a lot of patients who have been using cannabis, for appetite and for pain and for anxiety. And he told me, well, I think you're being a little overly cautious. No one ever died from a marijuana overdose. And so I liberalized, my thinking about it. I started learning a lot about it from the patients who had been using cannabis since 1996, and this was in 2015. And at that time, I was so impressed with the improvements that people were experiencing and not needing opioids for managing their chronic pain, just feeling better, sleeping better, that at the end of that a year of that, I thought this is a pretty amazing plant and people should have access to it and they should know about it. So I did a lot of studying. I trained the University of Vermont School of Medicine, has a professional certification course in cannabis science and medicine. I read everything I could. I went to every meeting I could. And
So,
over the course of a couple of years, I learned a lot about the plant and opened to practice.
wow, okay, great. So I want to sort of jump in there to say, what did you learn about how medical cannabis has all the effects that it does? You mentioned pain relief, you mentioned um, sleep management and anxiety management. How is it working in the body?
Well, we all have a neuromodulating system called the endocannabinoid system. It's something that we really don't learn about in medical school.
What do you mean
And
by
it is an,
what do you mean by neuromodulating? I'm sorry.
I'm sorry, it regulates all of the other neurotransmitter systems in our body. So people may have heard of serotonin and dopamine and glutamate and all of these neurotransmitters that affect our mood, our sleep, and also the immune system. So this endocannabinoid system regulates all of these other systems. So it's a large umbrella in the brain and in the immune system and other parts of the body that keep things in balance. And that's the whole point of this endocannabinoid system. And it's present in everything from sea squirts to humans. Insects have a different regulating system.
Hmm.
But it's a key to keeping things in what we called homeostasis or balance,
In balance,
and
yeah.
it keeps us in balance.
So
So
when
it
you well, I was just gonna ask you, so when you, ingest medical cannabis, you're saying that it affects this endocannabinoid system that's sorta like the regulator of all our neurotransmitters.
Yes, it affects the it does affect the endocannabinoid system. THC actually interacts with that system directly with receptors in the brain. There are other compounds and there are molecules in the plant that interact with the system indirectly, but also interact with a lot of these other systems like dopamine and serotonin and the immune cells.
So when it does that, what are some of the positive effects that we see?
Well,
What
the
are the
system
like,
is
the top
what
3 or 4 things that, you know, that we see that you treat using medical cannabis?
Okay. Well, the big thing is chronic pain because the system shuts down the pain signaling. That's what's part of the endocannabinoid system is to shut down the pain signal. So THC activates the receptors that will stop that pain signaling. THC, CBD, CBG, a lot of these other cannabinoids interact with the immune system and it turns down the compounds that the immune system makes that cause inflammation and turns up the what we call cytokines are these proteins that decrease inflammation and they have a big impact on a lot of those inflammatory compounds that cause things like rheumatoid arthritis and other autoimmune illnesses, and also COVID, the cytokine storm that we see, what we saw with early COVID infections. So it interacts with the part of the brain that helps us to relax. So it
Mhm.
decreases anxiety. It interrupts the chronic stress response. It relaxes muscle. It modulates or it affects how we metabolize sugar, how we metabolize cholesterol. So the what we say about the endocannabinoid system is that it helps us to sleep, eat, and relax. And these are the main things that we need to maintain good health is good nutrition, adequate sleep, restorative sleep where the body can
Mhm.
restore itself and heal, and relaxation because chronic stress and chronic anxiety and depression and all of these mood disorders disrupt our balance and actually
Right.
increase inflammation. And as we're
Right.
finding out, inflammation a lot of chronic conditions.
Right. I was going to say it sets us up for chronic disease. Now, when you and I were talking at first, you told me that there was a difference between medical cannabis and medical marijuana because I had started off our conversations talking about medical marijuana. Can you break down the difference that you shared with me for the audience? I found it really fascinating.
Well, I steer away from the word marijuana because the plant is the Cannabis sativa L. That's the plant's botanical name, and it was known to physicians for hundreds of years. It was used as a medicine for thousands of years, and it was prescription medicine in the U.S. for almost 100 years. When the director of the Federal Bureau of Narcotics saw that alcohol prohibition was going to be repealed, he needed to go after a new substance. And while doctors weren't using cannabis a lot because there were some dosing issues, and they found it easier to use pills like aspirin and morphine and things that were coming out in the turn of the century. The people who were using cannabis, who were actually smoking the flower, were mostly Mexicans and African Americans. So it was a population that didn't have much of a political or economic voice. And so they targeted this plant as something that would keep their funding. And in order to make the plant seem even more stranger and more foreign and ominous, they called it marijuana. And that was really to stir up people's xenophobic feelings or feelings against things that are foreign. So,
Right.
so I try to stay clear of the word marijuana, even though that's very familiar to people, because it was used in such a racist way to make the plant illegal.
I found that really fascinating. And then that brings us since we're talking about like different substances, what is the difference between hemp, CBD, and THC containing products in terms of what you might use them for?
Okay. Hemp is a lay term that refers to the Cannabis sativa L plant that has less than 0.3% THC. And that was an arbitrary level of THC that was chosen. So anything that has less than that is called hemp. Anything that has any plant that has more than 0.3% THC is referred to as marijuana. They're both cannabis. So CBD is mainly derived from the hemp varieties of the plant, although they're starting to use more of the what they call drug type plants to produce hemp. Hemp was part of the plant for thousands of years, and it got gradually bred out as people sought the euphoric high. And it is a more fibrous plant, the one that tended to have more CBD. So you can get CBD from a plant that has hemp, or that's called hemp, that has less than 0.3% THC, but you can also get CBD from the cannabis plant that's grown for medicine, because it may have just as much THC as CBD. So that CBD is the same CBD from as it is in a hemp plant, but it's in a different type of plant. And those plants tend to have more of those compounds called terpenes, which are found throughout the plant world that give plants their aromatic and medicinal benefits. And they influence how that CBD or that THC is going to work. So the strictly hemp plants are more fibrous. They're more produced to make canvases and sails and rope and fabric and
But
even
we've
bricks
been
to
seeing
build buildings.
yeah, but we've been seeing lots of CBD products, I know, in pharmacies and in health food stores. So it also seems like it's getting, in addition to those that you
Yeah.
mentioned, that also getting lots of exposure in other ways. I wanted to shift briefly to ask you, we've talked a lot about the benefits of medical cannabis. Um, are there people for whom cannabis shouldn't be prescribed or shouldn't use cannabis?
Well, it depends on the content of the cannabis plant. I would say blanketly, there's really no condition where no type of cannabis could be used. You have to be careful with THC in elderly patients who may be very sensitive to it, or to people with unstable heart disease where they get shortness of breath or chest pain with very little activity. THC you have to be careful with. With CBD raises intraocular pressure. It can actually increase depression. So people with glaucoma, people with severe depression have to be careful with CBD. So it depends on the condition. It depends on the content of the plant. Someone who has what we call cannabis use disorder, where they have a very severe psychological dependence on THC to the point where it's detrimental to their livelihood or to their well-being, they could use CBD, but they really should not use THC. Hyperemesis, patients with cannabis hyperemesis, they should not use THC. So it depends on the condition, and those patients should all seek medical advice on cannabis and not just get it from the neighborhood or in the drugstore, the CBD.
Right. What about pregnancy and the effect on the growing fetus?
That's a very controversial topic, and there's evidence on both sides. As a board certified pediatrician, I caution patients who are pregnant and breastfeeding not to use cannabis. Those cannabinoids interact with a lot of receptors that are involved with the formation of the fetus. We look at everything in pregnancy as try to stay with clean water, nutritious food, and fresh air. Anything other than that, there's a risk to benefit ratio, or flip side, the benefit versus risk. For
Right.
cannabis, if the benefit strongly outweighs any risk of causing any problems with the fetus, then we use it. And sometimes with hyperemesis or with severe postpartum depression, sometimes that's the only thing that works. But in those cases, we really feel that the benefit is so great that it outweighs any possible risk. But for
Right.
other things, for casual use, we strongly discourage using it.
Great. Okay, that's good to know. Now, is there a preferred way of getting medical cannabis into your system? Because we know they're different, through inhalation, eating, rubbing it on skin, etc.
Yes, I encourage patients to use oral administration or tinctures,
Hmm.
being that it doesn't take that much longer for them to start working when compared to inhalation, but they last a lot longer. And so you can dose once, twice, maybe three times a day and get those anti-inflammatory and other beneficial effects from the plant, as opposed to inhalation, which only lasts maybe 2 to 3 hours. Also, in a situation of COVID, we don't want to do things that are going to damage the little hair-like follicles that are in the airways, the cilia. And both vaping and smoking damage those follicles, and that's why a lot of people who do a lot of inflammation develop cough or increased sputum production. So tinctures are great for chronic issues. Inhalation is quick in, but it's quick out. It's like taking it IV. So it's really, I recommend it for when the pain is severe. Your pain is, 7, 8, 9, 10 out of 10. You want something in quickly. For people who are having a panic attack, vaping CBD can be such a great way to lower their anxiety level quickly. And then sometimes even a nasal spray is difficult to find nasal, but it has the same quickness of starting to act the way inhalation does, but it's sprayed in the nose, so it can be used as a rescue medication. for impending migraines or for seizures. And then the edibles, which are, I consider more the cookies, the brownies, they don't have much of a place in medical management. Those are more recreational. But eating cannabis, consuming it, and having it go through the liver actually increases the pain relieving effect. So sometimes a simple healthy fatty food like hummus or guacamole, you put the tincture in that and actually consume it. It may take a little bit longer to start working, but it actually has better pain relief. It also has more of the euphoric high or the impairing effect. So you have to be careful with edibles. The
Right.
gummies, the other things that they're candy. And the patients I see are all ill. They all have a lot of inflammation. So I only recommend those for carrying in your pocket or your purse to have something on hand if you're out and about and it's awkward to use a tincture, then those gummies and lozenges can be helpful.
I'm going to try to get in one quick more question, and that's, what do you warn people of in terms of dosing and potentially overdosing and some of the negative side effects that you mentioned people can have? What are some of the things you warn your
Those
patients about?
usually those usually occur with edibles because the time it takes for it to start working varies so much, and it's often quite long. It could be an hour or 3 or 4 hours. So people take some and they don't feel anything. Oh, I must not have taken enough. And they take some more and they don't feel anything. And then they take some more and then it all hits them. With tinctures, they take about 20, 30 minutes to start working. So I tell, take a little, wait,
Mhm.
then take a little more, then wait. You have to give it time to start working. Inhalation, you take one puff, you wait 15, 20 minutes, and sometimes that waiting time varies depending on the patient's experience with cannabis. If they're elderly and have never used cannabis, I'm very careful to have them wait quite a bit of time before they add on. But the mainstay of dosing in cannabis is start low, go slow. And if you
All
do
right.
that, you will give it time to work and you can see when you've had enough.
Got it. Well, thank you. We are going to actually go to audience questions. I hope everybody's been putting their questions in the chat. Wayne and Lila, please come on back. Let us know what you have, what you're seeing out there.
Quite a lot. Quite a lot.
We have a lot. This is a very interesting topic for me, and I won't say why, but it is. Um, so one of the questions I saw was from Yvonne. Yvonne and Tanisha and Vanessa Parker have so many questions. I'm going to start with you, Vanessa Parker. What is RSO? I saw it on a documentary on cancer patients.
RSO is it stands for Simpson Oil, and it refers to a concentrate that was first made or spoken about by this guy named Rick Simpson, who had cancer, and he made a concentrate that he took. He took very high doses of THC. It now refers to almost any full plant extract that is a concentrate. So it's sort of like we call a lot of things, oh, did you Xerox that? Well, the Xerox, it might not have been a
Right.
Xerox machine, but we kind of use it like that. So
Okay.
that's what RSO is. It just refers to a very highly concentrated paste, usually comes in a syringe. And the point of using, oh, and it has a lot of terpenes in it, and it's often used for patients who have cancer, either to control their pain or if they have a cancer that hasn't responded to conventional therapy. We don't advocate going to cannabis directly to treat cancer, but if there's like we're running out of options, then we'll go to very high dose THC, CBD, and oftentimes those very highly concentrated pastes are the best way to get those high doses into the patient.
Okay. We have a question from Marv West. I am subjected to random drug screenings at my job. will medical cannabis show up in the drug screen?
Yes, it will. It is the metabolite of THC that shows up in the drug screen. Theoretically, a medicine that has only CBD in it should be safe, but there's not much regulation in the industry, so you cannot depend on that. If you are going to be drug tested and you need THC for medical reasons, you should talk to your doctor about pharmaceutical THC. It's not going to do the same job as THC in the plant, but that can really be very helpful out there. I have patients like this where I use that for chronic pain, and it can be quite effective, and they can tell the difference between that THC from the capsule from the drugstore versus THC from the plant. And it's a shame that we have to go through all this.
Okay, Tanisha Monique Miles has a double hitter here. Can I treat sciatica with THC, and is treating sciatica through the endocannabinoid system?
Yes, and yes. THC is a good pain reliever, and it's good for both inflammatory pain and pain that's caused by a damaged nerve, which we call neuropathic pain. But some studies, we have a few studies out of the Netherlands, and what we see, what we call anecdotally, CBD combined with THC in equal amounts actually works best for pain. And this is great for sciatica because it's going to treat the neuropathy, it's going to treat the inflammation where the nerve root is being irritated, it's going to treat the muscle spasm. When the brain gets pain, it thinks there's an injury, so it causes the muscles to spasm so that you don't move and make it worse. But this is all maladaptive pain. It is not helpful at all, and many people have hideous MRIs and no pain at all, so there's no reason to be in pain. And CBD combined with THC is a really good combination, but THC does a pretty good job by itself if you have a pleasant experience from THC. If you do not, and if you can't be impaired during the day, let's say you work or you're driving, you should use CBD with THC. The CBD will modulate that impairing effect of the THC.
Good to
Okay.
know.
This comes from the Twitter Fingers family. So should I throw out my gummies and only use tinctures and or butters and oils with cannabis in them?
It depends on what you're treating. If you're treating inflammation, if you have an autoimmune illness, my answer is yes. You should just save your gummies for when you're out and about and use a tincture. And the reason is that they make the gummies, they add sugar, they add emulsifiers, they add colorings. These are all things that many people with chronic severe inflammation are very sensitive to. The microbiome doesn't like those ingredients. The immune system is governed very much so by the bacteria, fungi, and viruses in our intestines. And so the cleaner your diet, they were just talking about plant-based diet, staying away from the things, colors that don't look natural. A clean whole plant diet will really help. And so that's your garden hose. The good diet, the cannabis, you're putting out a fire, but those gummies, that's like a little can of kerosene, you're sprinkling on the fire, you're trying to put out. So just keep that in mind.
Okay, and tinctures come in the form of drops and sprays. And what else, Dr. Frye?
That's mainly the drops and
Okay.
sprays. The drops, they can be oil or they can be alcohol. The oil drops can go under the tongue. You get a little bit faster absorption. Alcohol is too harsh. It goes in a little water. You swish and swallow. There's sprays you can spray under the tongue that are very effective. And then there are nasal sprays that are hard to find, but when you can find those those are a great way to administer cannabis.
Okay.
We have
We
Any
can't hear
other
you, Wayne.
questions?
Oh, okay.
we have a question. We have a question, a couple questions. Does Marinol have THC, and what are tinctures?
Oh, we just answered.
Okay,
the-
You
great.
just answered that.
But well, tinctures, I'll tell you, historically, tinctures were made from soaking a plant in alcohol and extracting all of those active compounds into the alcohol. Now they do extractions and then infuse oils. We use the word tinctures rather loosely. Technically, a tincture is an alcohol extraction made from a plant, but we call the oils that are infused with these compounds, we call them tinctures also. Marinol is the trade name for the drug dronabinol. It is a THC molecule suspended in sesame oil. It's all by itself. But the beauty of cannabis is that it's not all about the THC. It's the THC and those other 119 or so compound or molecules only found in the plant and how they interact with each other and the way they interact with the flavonoids and terpenes that are found in the plant. So you're not going to get the same benefit from the THC molecule suspended in sesame oil all by itself. It's like the difference between like a potato and a potato chip. Technically, that potato chip has potato, but it's not the same nutrients, fiber, and vitamins that you're going to get from the potato.
And if I remember correctly, Marinol is used to treat nausea and stimulate appetite, correct?
Correct. And it's only FDA approved for those because those are the studies that it was based on.
Right.
It's only for nausea and vomiting associated with chemo, only for
Right.
anorexia associated with HIV. But it works for anybody who has nausea and vomiting.
Who has
It's
those
just that
issues?
those
Yeah.
are FDA
Yeah.
approved conditions.
So we have a couple questions coming. Once again, Yvonne, how does a person choose a practitioner if you want to use it? And is Dr. Frye taking any new pain sufferers?
Dr. Frye?
Well, the Dr. Frye does take new patients. And I'm licensed in quite a few states, and if I'm not licensed, I certainly in this state I can certainly give an educational consult, which sort of accomplishes the same thing. I might not be able to do a certification in that state, but I can give you the information. What was the first part of the question? Do I do
How do
consults?
you how do you go
choose a
about
doctor?
choose a practitioner? Yeah.
Yeah. Look for a practitioner that might have their own website, that may talk about cannabis, they may talk about other things. I would stay clear of most of the big telemedicine companies that you're going to, or not even telemedicine. They have some that are in office where you will have you in and out in 10 minutes. You're not going to get much from those type of consultations. Most doctors that really do a good job with cannabis education and monitoring and advising patients, they're going to spend about 40 minutes to an hour with you for an initial visit. One place you can go and try to find some of those practitioners is the Society of Cannabis Clinicians. We have a website, it's a nonprofit, and we're all about educating healthcare professionals. And you can go to that site and you may find some practitioners in your area, in your state, that can help you.
And I think that's a really key point, what you said about spending the time with the patient versus basically the cannabis mills where, they just write your prescription and send you on your way. There's still an evaluation that should be done because sometimes pain is the manifestation of something more serious going on, right? So you don't want somebody who's just going to write your prescription and send you on your way. You want somebody who's going to spend time and help you get to the root cause of what the problem is, in addition to perhaps also prescribing medical cannabis. So I think that's an excellent point.
Lie?
Oh, I lost it.
Okay. Let,
Yeah,
let,
I'm sorry.
let's go
I
back.
was so enthralled with what Dr. Frye was saying. I just completely
Right.
went off my post.
Right. Right. We do have a statement though. This comes from Lori Tanner Hines. Medical marijuana took the place of 3 Percocets and 2 morphine pills a day, plus
Wow.
helps me mentally deal with the chronic pain.
Wow, that's a
Excellent.
testimonial. I want to throw in one question here. So people react to cannabis in different ways. Is that a genetic issue? Is it an issue of other medicines that they might be on? Is it an issue of, their weight, their metabolism? What makes people react to cannabis in different ways?
It's the difference in the receptors in the endocannabinoid system. Everyone's system is very unique. And there are a lot of what we call polymorphisms on these receptors, meaning that there are little differences in how this receptor is going to accept that molecule. So age can be a factor because as we age, we kind of down regulate our endocannabinoid system. That's part of aging. We become more sensitive to THC because we produce more receptors. We're trying to keep things in balance. The weight does not seem to be a factor. We have, little people on big doses, and that's what's needed to alleviate their symptoms, whereas some older, bigger people do just fine with microdosing. So it's really about the genetics and how your receptors, how many you have, and how that is a lock and key system, whereas the receptors, the lock, and the molecules from the plant's the key, and they're different locks, and there's just a lot of variety in that system from one person to another. And that's why some people do THC and they love it. That's the euphoric high. For other people, it causes anxiety. It's very what we call dysphoric. It's
Yes.
uncomfortable. They don't like it. So everyone responds to it a little bit differently.
And I can attest to that from being in the emergency department, taking care of many people who come in with that dysphoric response, as you mentioned, heart racing, panicking. So it really depends, as Dr. Frye said. Listen, this has been just amazing, a tremendous amount of information. Thanks so much,
Amazing.
Dr. Frye. Really enjoyed having you. Thanks to the audience for the fantastic questions you asked, and of course to Lila and Wayne for helping us walk through all of this today. Um, before I go, and before we wrap up tonight, I want to just remind my Be Health Empowered family out there that there's a special research study at Howard University. They've asked me to invite anybody that listens to the show to participate in it. It's called a COVID resilience research study. It's participation totally voluntary. You just have to fill out a 2-part survey for which you'll be compensated up to $100. So if you have any interest, please reach out to Dana Harvey. Email her. Her email is danaharveyresearch@gmail.com. You see it right there, Dana, Dana, Harvey, Harvey, research@gmail.com. Well, that is it for us tonight at Excuse Me Doctor. Thanks so much for tuning in. Have a powerful week until I see you again next Monday, 9 p.m. Eastern, 6 p.m. Pacific. And until I see you, please remember to be wise, to be well, and to be health empowered. Thanks.